now, a lot of people see healthcare in the US as in a failure mode, rife with misaligned incentives and highest spend for the lowest quality of care of peer countries. I'm wondering, what is your take on that? And then what is in your crystal ball or your or even a microcosm of medical devices, what is that positive looking step by step that will advance healthcare in the US?
It's a very difficult question because I think even famous key opinion leaders do not know this answer. They try, all people try, but what give me some, I don't know how to say, give me some chance, I can give some chance to these, that it's an open market. And people try to find themselves in this market. They try to innovate. So it looks like it's a numbers game. At some point, it will be so many innovations that it will just go through all their paved road that is really was paved by wrong things, maybe good things 100 years ago, but finally that brought us to the wrong situation. And I think it's only about freedom of innovate, freedom of operation, little bit control by the government to watch, like a conscience. Your conscience, just pay attention, to pay attention and guide the development, but to give their development of innovation, free development of innovation, and free market for this, and the best will win, and finally will change the status quo. But it will be very difficult, and what I see, it needs another generation to have it, because when I work with physicians about 50, 60, they are very much more difficult to move to something new, or they get to move, but because of different reasoning, money or something like this. And the new physicians, young physicians, if you just check telemedicine companies, you will see that in the board you will find old professors, old physicians. What they do in the board, I don't know, just because of name. But who is working really in place? It's young physicians between 30, 40 or till 50 who gonna bring or also have some side gig, but at the same time to grow like physicians in a new type of, I even could say civilization, because it's really, we come to a new civilization, new health economics. And this is what happened, but it needs at least one generation of physicians to come to this place.
Right. Yeah, gosh, and that seems so far away compared to a lot of the challenges.
Unfortunately, yes.
Yeah. Okay.
20, 30 years when all these big numbers will break down the old system.
Right. Yeah, it may have to completely fail. Yeah.
But if you will have a single payer, like in other countries, it will take much more time because you don't have freedom of innovate in this case.